Good morning, everyone. It is 9 o'clock, Thursday, May 14th, and I would like to call the Humboldt County Board of Health regular meeting to order. First thing I want to do is have a roll call. Board members, Commissioner Cherry.
Present.
Commissioner French. Commissioner Risden.
Here.
Commissioner Bell.
Here.
Sheriff Allen.
Here.
Dr. Stringham.
I believe he's there, Chair. I see him here, but
I
was
see there.
muted. Yes, I am here.
Okay, and Dave Mendiola, you're here, and this is Ken Tipton, and I'm here. So with that, we'll go to a Pledge of Allegiance. You have a flag ready, Dave?
I do.
I pledge allegiance to the
To the
flag,
flag
United States
The
of
United
America,
States of America,
to the republic
Republic
for
for
which
which
it
it
stands,
stands, one
one
nation,
nation, under
under
God,
God,
under God,
indivisible,
with
indivisible,
liberty
with
and justice for all.
justice for all.
Thank you. And we'll go now to public comment. Do we have any public comment that someone would like to talk about for a matter that's not appearing on this agenda? No action can be taken on these items raised until those items have been specifically included in the agenda and the item upon which action can be taken at that time. Any public comment? If you have public comment, please *6 and unmute your mic. Any public comment? Not hearing any public comment, we'll move on to the next item. It's an update from the Public Health Officer, Local Emergency Manager, Public Information Officer on the county response to the COVID-19 coronavirus. Presentation by Dr. Charles Stringham, Public Health Officer, Captain Sean Wilkin, Humboldt County Sheriff's Office and Local Emergency Manager, and Nicole Maher, the Public Information Officer, regarding current status of Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding efforts to mitigate the spread of the virus. In addition, the group will update the board regarding the dissemination of information to the public through various methods. We'll start this off with Dr. Stringham.
Good morning, everybody. This is a very pivotal week for us. There's been a lot of things that are happening here in the community with response to, with respect to our COVID-19 response. And the most conspicuous is the opening of our so-called non-essential businesses. I don't think any of us think that any business is non-essential, but they're defined that way. And I think things are going fantastically. We're very pleased and I have some good information to share with all of you this morning regarding that. This next week will be an even larger week for us. And the reason is the initial data on any infections that have been acquired in the recently opened businesses will come in. And that's exactly when we're going to start seeing infections in the event that they have occurred. And I'd like to propose that I don't think we're going to see a large increase in the number of cases. In fact, I don't think that it's likely by looking at a graph that we would even be able to tell when the business is opened. And the reason is because I think in general, we've talked previously about the fact that many of the cases have been acquired in the private sector in non-managed environments. And from what I've seen so far, I think a lot of our business owners are really part of the solution, and I'm very pleased with what's happened. The assumption had always been made that bringing people together under any circumstances would be dangerous. Many of us had theorized based on the information we were seeing that that wouldn't be the case. And some of the initial data that we're seeing seems to support that. So, but what I think is because the virus takes a few days to be acquired and to come to fruition, to be diagnosed, I think those initial cases that may be acquired in businesses won't be seen for about the next week. And because I always like to stick in a little bit of information of a medical nature, kind of a teacher at heart, and I'd like to give a little bit of information this morning that I think will be interesting to other members of the board and members of the community in terms of knowing exactly what the leading edge of this virus looks like, the initial defining features of virus. And so briefly, there are four events that occur when a person develops this virus. The first event is acquisition of the virus. That's the day that a person who is going to become infected develops this virus. They acquire the viral particles, and that is the first point at which that virus enters a person's body. That's a silent event. There's no way to know that that's happened. And the second event is the day that a person theoretically would become infectious to others. And they have produced enough viral particles that now, in close proximity to others, it would theoretically be possible for them to infect somebody else. Viral particles are still very small in number, and it's possible that they could infect somebody, but the contact required would actually be pretty vigorous because the number of viral particles is still small. But the reason this is critical is because there are not yet enough viral particles to have a test become positive. And that's the third step. The day that a person theoretically would become positive, a person gains the capacity to have a positive test. That's the third event. All three events so far have been silent. There's no way for anybody, including the patient, to know that they've become ill. And finally, the fourth event is the beginning of symptoms. This is the first evidence that we see overtly that this person has a problem. And the reason this is such a big deal, and the reason I want every single person in the community to understand what this time course looks like, is because if you look at this time course, it becomes very clear that testing people in order to know who you should stay away from is not an effective strategy, because there's a short time when a person theoretically would not be capable of demonstrating a positive test, but yet they are capable of infecting other people at very close range. These are not going to be 6 or 8 foot contacts. It's going to require that two people come very close together, but you could theoretically infect somebody on that day. And it also speaks to the issue that our number one strategy, in fact, our only strategy for fighting this virus effectively through prevention, which is the number one way to do it, is social distancing. There's no substitute, there's no technology, there's no mindset that will allow us to not social distance. We must social distance, and that's the only way that we can prevent this from spreading. There's no technology that will do that. Critical that every one of us knows that. So I love to squeeze in a little bit of science into our presentations because I think it's critical that we all learn to think this way for those people who don't already. So the next issue I'd like to talk about is the number of cases that we've had in Humboldt County so far. And the number as of today stands at 71. Last week when we visited, there were 58 cases that we'd had. And that meant that we added 18 new cases in the 7 days prior to that meeting last week. This week, we've added 13 cases. And I'm very happy about that because essentially we went from adding approximately 3 new cases each day to adding approximately 2 new cases each day. And I'd like to point out that also happened during the time that businesses opened. And as I said previously, the data on businesses having opened and the infections that theoretically would be acquired, that leading edge of infections has not yet come through. But the preliminary information is looking very good. I'm excited about this. The other thing that's wonderful is that Humboldt General Hospital currently has a total of 0 COVID patients in the hospital. That is absolutely fantastic news also. This is really nice to see this number of weeks into the infection. Also, the number of patients in Reno from Humboldt County who are currently hospitalized, that number stands at 1. So there are a lot of things to be very thankful for. I'd like to point out again that it's erroneous to think that this is happening at the exact same time the businesses have opened, because that data should come in about a week. But the initial data is looking very encouraging. I'm really pleased about this. The total number of deaths stands at 3. We have not had anybody pass away in the last several weeks, which I think is also fantastic news. This is not grounds to rest on our laurels, but it does indicate that the things that we're doing are working here in Humboldt County. The FAST team is doing some fantastic things. Been a very big week for them as well. And our 2 principal team members, the Whitakers, Ken and Debbie, are doing just a fantastic job. They are literally working 7 days a week. I'm never able to call them without them being there at their telephones. And it's a really neat thing to see. We're doing a great job with that team. Very proud of what they're accomplishing. Their case tracings and contact tracings are going very, very well. And earlier in the week, in fact, last week, they had done a class that had been part of the state's recommendations that we take those classes. And Ken and Debbie both completed that class and are now fully qualified to interface with the state's computer system. And they're considered the equivalent of a state investigator. And so they are now adding data to the state's investigative database, and the state seems very happy with them. And I sure am too. I'm just my thanks go out to them. I think things are going absolutely fantastically with this team. The FAST team has also derived some data that I think is very interesting. We're using this data not just to determine who's infected and what the contacts look like, where these contacts are occurring, but we're also looking at how people are receiving data. It was known in the early days that the FAST team would be able to help us direct our community approach, and that we would be able to learn what the trends are and not just go into this with suspicions, but with hard data. And one of the things that the FAST team has completed as of several days ago is we now have the leading edge of information as to where the patients who are getting this virus and coming into contact with those who have this virus, those people who are right there at the apex of this fight, how they get their information. Many of us are on Facebook, many of us read the newspaper, listen to radio, do a number of other things to get information about all kinds of things, including COVID. But it's an interesting trend that the vast majority, overwhelming majority of people who have been infected by this virus or who've been in close contact with people who've been infected by this virus are not on Facebook. 70% of people who have acquired or come into close contact with this virus are not Facebook users, at least not regularly enough to be seeing our public service announcements. That was a real lesson. And we've suspected that. It's speculated that our penetration into the number of people that the fact that we weren't able to reach as many people as we thought we were on Facebook turned out to be true. And we've already devised a plan, and the first prong of that plan went into effect yesterday. I'll talk about that here in a couple of minutes. So the number one way that people were able to receive messages of those people closest to this fight, those people who are infected or in contact, 44% of them did hear the Humboldt County Sheriff's Office IPAWS announcement that was done last weekend. And that was very interesting also. It's a wonderful technology. The downside is it's a little bit obtrusive, and there was a tone that went out. People received a text shortly after that, and a lot of people were alarmed by this, even though it was definitely not an emergency. But the Sheriff's Office did a fantastic job in being able to get information out. And in fact, Humboldt County Sheriff's Office was the number one way that people were able to get information about this virus. So when we learned that, we stepped up efforts to use the Humboldt County Sheriff's Office alert sense system. And yesterday, I had given a public service announcement that went out to approximately 1,000 people. And we're going to be coming up with a better way to get to a larger number of people today. So my hat's off to the Humboldt County Sheriff's Office. They are the number one way to get information out to people. We hadn't realized that. The other thing that wasn't so good was that in the single digit market penetration was actually quite small. The number of people who were receiving their messages by radio by direct flyers, and by newspaper. And those were all in the 1% range, meaning that only 1% of those people directly affected by this had heard anything in those various media. We'd like to continue to use them. We appreciate our partners in those various media types. And so I do not think this is grounds to eliminate our advertising campaign or our awareness campaign in those media. I just think that we need to market things a little bit more directly. The FAST team is also doing a number of other things that I'm very excited about too. They're still working on the respiratory isolation protocols, and in fact, they are going to be coming up with a better way. We'll be visiting later today, come up with a better way to remove people from respiratory isolation. As is often the case, because there are so many entities involved, not everybody's on the same page. And so even the CDC has had a number of different release protocols, meaning the time and the reasons, the criteria for ending a person's respiratory isolation. And ideally, it would involve a test. But in the early days of this virus, we didn't have enough tests. So the CDC came out with a way to be able to safely release people from isolation without testing them. And at this point, I'm happy to say that we don't need to use that system anymore because tests are no longer, they're still in short order, but no longer in very short order. So we absolutely can release people based on testing, and we'll be changing our official policy. We've already done that, and we'll be publishing that policy here in the next couple of days so that people will know what the criteria is. The state had been sending some letters to people with the old criteria, and we've been educating patients most recently who are most directly involved in this, that those letters are no longer valid, that the state had been sending those in response to outdated criteria, and that the letter essentially just hadn't updated to reflect what's going on now. So the hotline also had been doing some things like that. And so as a result, there were a few people who were released from isolation by the old criteria because they had called the hotline and received a recommendation that they go back to work. And the FAST team was able to intervene on that and get those people back into isolation so that we can use our new criteria, which is safer. So I just wanted to explain that was what had happened. Our number one priority in shifting gears is to engage the non-engaged. We talked about that last week, and we have a number of different ways that we're doing that. So one of the ways is improved techniques of communicating with the public. And both the iPause and the Alert Sense system are the systems used by the Humboldt County Sheriff's Office. They're kind of like reverse 911 type systems, although that's not what they are. And they're a way that the Humboldt County Sheriff's Office is able to reach out to the public. There are subtle differences between iPause and Alert Sense, and we're working with both of those systems at this point in order to get this message out. We also have a Spanish-speaking campaign. Yesterday's Alert Sense that went out from the Sheriff's Office went out in English, and we're hoping that today we'll be able to get that same analogous message out in Spanish. The problem that we're having is there isn't a way for us to know which phone numbers should be spoken to in Spanish on a recorded call and which are English. And so the way that we've decided to handle that is Lily is going to help us. She's also part of the FAST team. And she's going to help us with a Spanish-speaking communication chain in which people will communicate with their friends because they're going to know who speaks Spanish and who doesn't. So it's kind of a chain letter by phone. And we think this is about the best way to be able to handle things. There just doesn't seem to be a way to know who speaks Spanish and who speaks English based on telephone numbers. So that's the way that we've come up with initially to combat this type of an issue. Mask use is increasing. We're very excited about that. I think things are going very nicely. The majority of people, when I've gone out in the mornings and at night, kind of walked around and done various inspections, it's been very nice for me to see that most people in general are wearing masks. So I'd like to talk a little bit about the Lowry High School prom and graduation. We've been involved at the county level with the school. Multiple officials have reached out to me for advice on how to distribute various gifts. Lowry has approximately $30,000 that have been donated by various community members for gifts and various things that will be given to the graduates. And we've also come up with a way to officiate prom as well as the graduation ceremony itself. We think the program is designed to maintain as much of the fun as we can to celebrate the accomplishments that these residents have had here in Humboldt County, but yet still be safe. We have a good plan as far as that goes. So, and I'd like to discuss a little bit about the community-based testing program, and very pleased that it will be starting today. And I know that Captain Wilkin from the Sheriff's Office is going to be talking a little bit about that, I suspect, this morning. So thank you very much, everybody. I'm very proud of the accomplishments, and I think we're doing a wonderful job. Thank you.
Thank you, Dr. Stringham. And we'll move right into Captain Wilkin, our Humboldt County Local Emergency Manager. We'll have your report now. Are you there?
Good morning, everyone. This is Humboldt County Sheriff Mike Allen. Unfortunately, Captain Wilkin couldn't make it right now because he is over at the event center, helps do some final touches setting up the community-based testing. As a result, I'll go ahead and just give a quick briefing on what has occurred. And first of all, thank you, Dr. Stringham, for all that good news surrounding the community. And Dr. Stringham is right. It is two mass notification alert systems that we have. One is AlertSense and the other one is IPAWS. The IPAWS system is similar to whenever we receive an Amber Alert. That's the same system that is used for Amber Alerts. Last night, we did try to get more information out using the IPAWS system. However, we had some glitches. Those are being worked on right now. So we will be sending out a couple of IPAWS alerts later today. One will be in the English form and one will be in Spanish. The way I understand, when we use IPAWS, it will basically hit every phone in our region, in Humboldt County. We can direct it there. Even people traveling through that don't live here, that are on Interstate 80, will be able to receive these messages. Now, back on the community-based testing, late last week, or actually mid last week, we made a resource request into the Division of Emergency Management to start a community-based testing event. As a result, they were able to move that as quick as they did into this week. So today from 12 to 2 p.m., they will be conducting swabs for volunteers, and we want asymptomatic individuals. We don't want anybody showing any signs or symptoms of the flu. So we want to make sure that people that show up are asymptomatic, have no signs or symptoms of having any type of flu. If they are going to be screened for temperature, if their temperature is elevated, they'll be turned away at the scene or at the site. For those of you who are going to do this, so from 12 to 2 is for first responders, healthcare workers, and people like that, law enforcement as well. And then from 2 to 10 is for mine and swing shift and night shift workers for the miners. And then it's being conducted from today until Monday, but Sunday is a down day. And so Friday, tomorrow, it goes from 9 to 10 a.m. will be healthcare, law enforcement, first responders. And then after from 10 a.m. to 5 p.m. will be the general public, as well as on Saturday will be 9 to 5 will be the general public, and on Monday 9 to 5 will be the general public. If you don't do this, I would suggest that you go over and see how this is being conducted. Kim Peterson was a big help with us as well. We were able to we're going to be pulling the cars inside the event center itself. They have 7 lanes for cars, which right now I believe only 4 lanes will be operational. But if we get more people to help us and assist us in this, we'll be able to open more vehicle lanes up to pass through this process in doing this community-based testing. So we are looking forward to this. We hope we get a lot of volunteers out there do this test. It is a nasal swab. And as we learn the results, which is probably going to be at a minimum of 72 hours, phone calls will be made to those individuals to indicate whether their test was positive or negative. But it could go beyond a little bit over the 72 hours. And I just want to do a big shout out to the Nevada Division of Emergency Management for helping us get this set up. We've made numerous trips into the Reno area this week, picking up tests. The police department has donated some much needed ice chest in this. And this is truly a huge community event. And I just want to thank everybody for their assistance on that. Other than that, that's kind of where we're looking right now.
Okay, thank you, Sheriff. Either you, I guess, or Dr. Stringham, could you comment a little bit about what the community testing is for, community-based testing is for, and why they're doing it?
Oh, maybe I can take that. So there's a number of different things that we're trying to learn. So the first, as I understand it, was to determine how many people in the community roughly have this virus currently. And I think the way that we're doing this will provide data that will speak to that. And I think the state is interested in having a greater number of people tested so that we can have a better idea whether this virus is more infectious than we had thought it was, and exactly how many people have this asymptomatically. And so the data that we get from this will absolutely be very useful for us. It'll be interesting to see what those numbers look like. And I think we're going to be able to learn a little bit more about the virus by doing this. So that really is the spirit in which this test is based.
Okay, thank you, Dr. Stringham. Let's go to Nicole Maher. You want to give us an update today, please? I see you're on, but there you go. Are you on mic? We're not hearing you, Nicole.
Can you hear me?
Now we can.
Okay. My
Oh, yeah.
apologies. It seems like the internet is being very slow today. Well, good morning. And first of all, I just, as part of my report, I wanted to let you know that we have a hero among our midst. Dr. Stringham was chosen by Nevada Health Response to be our Nevada Hero of the Day. And so they acknowledged his many contributions, including all of his efforts at rallying our community to socially distance and wear facial coverings, and especially assembling the FAST team and those kinds of things. And as I was speaking with our Nevada Health Response team members in one of our phone calls, I let them know that we very much feel like we hit the jackpot with Dr. Stringham, and we're very grateful for him. I wanted to just share some different concerns through my listening efforts, what people are feeling and what's happening out there. The first one is on a national level. This past week, last week, a video was released. It's a kind of a conspiracy video, and there are all sorts of conspiracy theories that are trending right now, from that 5G is spreading the virus. But this one was especially concerning. It's called Plandemic, and it was a 26-minute video that was released. Just to give you an idea of its spread, uploads of Plandemic have more than 8 million views. Now, that's not just one time 8 million views, that's multiple times across multiple social platforms. Like one YouTube version hit 7.1 million views before it was removed, and they have been removed. It's a really slickly produced video, and it has been banned by Facebook, Twitter, and many of the other platforms. But some of the unfounded claims that it makes is that masks actually activate the virus, and that a vaccine against COVID-19 would actually kill millions as opposed to saving people, among many other things. The reason why I'm noting this is that I personally received an invitation from a dear friend of mine who said, wow, this makes a lot of sense to me. And I had not heard of the video, but I Googled it and was just astounded at the claims that were made by a former scientist who worked with one of the national institutes. So just to make you aware of that kind of making the rounds, and we might see that. And so if that comes your way, please help those know that that has been debunked literally by every legitimate organization. I wanted to now move to some local concerns as we're working on this community-based testing. Special thanks to Sheriff's Department and Emergency Management, of course, all of our county folks, and Marcia Foreman at Community Health. These are some of people's concerns as we're trying to make sure that people get there, and so that we really can have this more global picture of what COVID-19 looks like in our community, and identify gaps and answer what are we missing, and be able to have that data that will not only help us move through more phases of business reopening, but allow us to more effectively fight the virus. One of the things that the sheriff just addressed was that sick people will be at this screening, and we are making every effort to help people know that people who are experiencing COVID-19 symptoms need to go through Humboldt General Hospital. As you're aware, that screening location, pardon me, has changed back to the main hospital campus, using the ramp entrance on Mizpah, and doing very well. And they have a high capacity there to handle any people who need to be screened there. Another concern among people is whether this is antibody testing versus screening. And so we need to make that very clear. This is not antibody testing. This will not show whether you have had the virus previously. It will show if you have the virus right now, which is, as Dr. Stringham said, very important as we determine how many people have had this asymptomatically. Another concern among people is that there is an insufficient amount of tests. This one has stymied me a little bit because 2,000 tests is an enormous amount for our community, and we're excited about that. There is not an insufficient amount of tests. I've seen some comments like this: I probably should be tested since I'm essential and have an underlying condition, but I don't think there will be enough tests, so I will not go. And so as you have those phone calls or those reach outs, if we can share that there are plenty of tests, there are plenty, as the sheriff noted, plenty of drive-through stations for people to be tested quickly and efficiently. And our initial information was that we could do one person per vehicle. That changed. And so we had some initial information that went out for about a day that we were doing one person per vehicle. Now we would like people to know that multiple people can come in a vehicle, but they all need to be from the same household. And there's a reason for that, among other things. But one of the reasons is people have different exposure experiences even within the same household. Some may work, some may be doing different things. And so while one person could test one way in a household, another person could test another way, but that would also be important as we identify who needs to be followed by the FAST team. Some other concerns from our community: why waste tests? I do not have any symptoms. I will save the test for other people. Again, the entire purpose of this is to try to identify asymptomatic people. Marcia Foreman shared some astounding results from Fallon that within, Marcia, my apologies, I might get these numbers wrong, but within the first 47 people they tested, or the 47 people they tested initially, 15 of those were asymptomatic. It might have been 14. I apologize if I didn't quite know that number. But very honestly, 1/3 of those people, I'm not saying that will be our case here, but it is an indication that certainly there could be asymptomatic people in our population. Another concern, people are worried about being reported positive on a medical record, that could have consequences for them later on as they try to get health insurance, that perhaps as our nation looks at this later on, that it could have dire consequences in seeking employment or any of those things. These records are private health records, and they certainly would not have any kind of negative influence or consequence for certain things later on. Other concerns, this one was concerning to me. I'm not sure where this would be coming from, but people concerned about these tests being contaminated, that instead of these tests being able to screen for coronavirus, they would actually give coronavirus, that there would be that risk of actually infecting somebody with this virus because they were made in a different part of the world or something like that. These tests are absolutely pure, ready to go. They are not contaminated in any way. The next concern that I personally had as I listened through our channels over the past week, or past few days, since we announced this, just a significant amount of peer pressure from some who, as Dr. Stringham calls them, are not engaged in the fight. A significant amount of peer pressure to not take part in this, to not be tested. And I just want to thank, in fact, there's somebody in our audience here who has been a great advocate for us, Millie Custer, and sorry for calling you out, Millie, but I just appreciate you so much. And she just has advocated for us on these channels and has helped us know that we all need to do our part to move to our next openings, to further this cause, to get this data, and just appreciate that so much. And kind of the last point is people who just don't see the point or the relevance of being tested. Several, in fact, have said, what a waste, that I could be negative today and positive tomorrow. And so what does it matter? It does matter. We are looking for as I said, as far as our community, a global snapshot of what is happening right now and during this time period. Again, people not understanding that this really is for asymptomatic people. We have numbers on symptomatic people. We've been reporting those numbers. I personally have been reporting those numbers. Now we need to see what this other group looks like. With that in mind, I want to just address briefly, we feel like we've done a pretty comprehensive job of getting the word out about this. We'll continue to do that over the coming days, all the way through Monday. Still trying to push people out there. As far as just communication in general about COVID-19 prevention and screening, it's the data that we have received through our FAST team has been very important and to some degree not exactly surprising. I don't believe that people just naturally flout good, solid recommendations. And so the people who are on those channels, who are receiving those recommendations, they are following them, and we thank them so much. As I mentioned last week during our meeting, we're dealing with two very different publics. One public who perhaps has a higher possibility of infection because they might be associating with or living with somebody who has that virus and not knowing that. And then another public who just needs information, who needs to be shored up with current information and things like that. The other thing that we're looking at here is a continuing cycle. And so as Dr. Stringham said, it's not that we're going to stop our other efforts to now just concentrate on this phone line or doing other things. We do have a continuing cycle that we need to continue to monitor between active publics. Those would be people who actually actively have the virus. Emerging publics, those would be people who have the potential. They're at a higher risk, those core risk groups that we've talked about. And then potential publics, those people who at any given time, just because of circumstances or setting, could actually get this virus. And so we just need to continue to be vigilant, to continue to feed information, and acknowledge that we're dealing with different people in different settings and different exposure experiences, and just try to meet them all where they're at. Over the next several days, I will actually be addressing many of these concerns, these local concerns that I've shared with you today. Would like to address those in various different ways across our channels, and appreciate the radios and the newspaper and others for helping us as we do that. And the goal will be to just get as many people as we can out to that community screening. That is our priority right now. I'm happy to answer any questions that you have.
Hello, this is Sheriff Allen. I just want to touch on one thing, Nicole, that you said. I just want to let everybody know, everybody remains in their vehicle as they're going through the test lanes as well. Nobody gets out, so it's all done from within the vehicle. I just wanted to clarify that as well. Thank you.
Sheriff Allen, this is Ken Tipton. I cut out, or you cut out when you were giving the schedule of the testing. Could you go back over that one more time?
Okay, yes. So on the testing starts today from 12 to 2. Will be healthcare, law enforcement, fire, and first responders only. From 2 p.m. to 10 p.m. will be mine, swing shift, and night shift workers. Tomorrow, Friday, will start at 9 a.m. to 10 a.m. will be healthcare, law enforcement, fire, and first responders only. And then from 10 a.m. to 5 p.m., it's open to the general public. Saturday, May 16th, from 9 to 5 is general public. And then Monday, May 18th, is 9 to 5, the general public. Sunday is a down day. It's not going to be open. Sunday, give our workers a chance to take a break and have a day off. So Sunday's the only down day, but we're, once again, Thursday, Friday, Saturday, and Monday. If anybody has any questions, they can, of course, call us. Our dispatch center, non-emergency, would be 775-623-6429. And to get more information, or our office here, 6419, that would be 623-6419, or our Central Control Division, which is 623-6428. You can reach out to us if you have any questions on testing times and dates. Thank you.
Thank you, Sheriff. Does anyone have any questions for Nicole or the sheriff or Dr. Stringham?
Chairman Tipton, this is Commissioner Cherry.
Yes, go ahead, Ron.
Sheriff Allen, there was reported that we're going to be some testing in the rural areas, specifically Orvada. Is there a date for that?
Right now, I don't have that date. Marcia Foreman, the community health nurse, is the one organizing that. So we'll reach out to her and find out when she's planning on going up north to Orvada.
Okay. Do you think that'll be within a week or?
I do think it will be within a week. I don't have her phone number with me, or I'd send her a text right now. I might be able to get that information before our meeting concludes today.
And would that be dependent on if there's still tests left, or if, you know, that they're not all used up, the 2,000?
There will, from what I understand, there will be tests available for us to do the north collection site for the testing.
Okay, thank you.
Any other questions? Hearing none, we will move on to next one is the data regarding COVID-19 spread in Humboldt County. Presentation on data behind the COVID-19 spread in Humboldt County, including demographics, active cases, pending cases, and other pertinent information to better understand the virus and the impact on Humboldt County and City of Winnemucca. I think Dr. Stringham already gave most of that, but if you have something to add on that, go right ahead.
Thank you. I think that it's true. We did go over most of that, and I think that I'd like to bring something up, if this would be an appropriate time, about kind of a response to what Nicole had said about some of the misinformation that's out there. Would this be an appropriate time to discuss that?
Sure.
Okay. I'd like to say that I'm very worried about the misinformation on the internet, and I think that essentially what's happening is a very common thing in the sciences, and that is we are essentially turning what is a mystery into a puzzle. I can hide something in plain sight so that that information is really no longer available to people. And it's kind of a funny example, but if you ask me, did you rob the convenience store? I can confuse you in two different ways. I can turn that into a mystery and say, I'm not telling you, I'm not giving you the information you need. But I can also hide my answer in plain sight in the way that the internet is very famous for. And that is, I can give you a typical internet answer to, did you rob the convenience store? And I would say, yes, no, maybe. And there are 3 convenience stores within 4 miles of you. Would you like directions? The problem is that the internet is a great place to confuse the public. And so for those members of the public who are listening now, I ask that you listen very carefully to those people in credible positions, and that each of us understands what the motives are that people have to say various things. And I think that there are groups who probably are anti-government, or groups that have other specific specialty axes to grind. And this is just a wonderful time for them to wreak havoc on the rest of us. So I would encourage all members of the public to look at these types of claims, that the virus was fabricated, that it's not real, that it has other motives to exist, or other motives that people have used to make it exist. And these are just not true. And all of us, I think I speak for all of us on the board, all of us have an interest in fighting this virus successfully, doing the right things, and making sure that the havoc wreaked on our community is minimized. So please do not believe these types of claims that Nicole had outlined, that we know are on the internet, and look at the difference between a mystery and a puzzle, and understand that these people are attempting to hide information that will save your life. They're attempting to hide that information in plain sight.
Thank you, Dr. Stringham. Did I hear, David, did you have something you wanted to add in there?
Yes, Chair Tipton, Dave Mendiola. I think, and I'm not sure, but Nicole may have some graphs she wants to show us. I know we did this last week, and I found it very helpful to get a different view of what we're experiencing. I know Dr. Stringham covered the numbers, which were very encouraging. So I don't know if Nicole wanted to just tell us if she's prepared to share that.
I'd be happy to, Dave. I've put them up on my screen here. Can you see them?
I don't see your cameras on, Nicole.
Yeah, don't see them at this point, Nicole. There we go. Getting closer.
Perfect.
I see them now.
Now we just need to get you off mute. And we're good.
Can you hear me now?
Can hear you. We don't have the screen anymore. We don't have the app.
Okay. Let me try it one more time. Okay, now can you hear me and do we have the screen?
Yes. Very good.
Okay, perfect. As Dr. Stringham said, we are still at 71 cases. We are grateful for a few days reprieve. However, I do need to let you know that according to our infection preventionist at the hospital, Janet Sturts, the state is greatly backlogged right now. And so we do have quite a few pending results. And so I just say that it's taking 4 to 5 days now as opposed to 24 to 36 hours as before to get results. But if we do have multiple results, as Dr. Stringham said, we are looking for some numbers since businesses have reopened more. But we need to be very careful about attributing any kind of even minor spikes to that. We need to also factor in how the state is testing right now. The only truly discouraging thing from this past week is that we had our first child that tested. And I think we have all felt that children have kind of been immune from this or things like that. We actually have seen several teenagers in those lower teenage numbers and then this child who tested. And so just a reminder that our young people are vulnerable and they need to be protected as well. They can wear masks and they can socially distance and take those same precautions. Here's another look at that. Again, as we saw last week, our highest number is in that 50-year-old range. And pardon me. And our next highest is in the 20-year-old range, which again is somewhat discouraging that perhaps the right precautions are not being taken, and we want to stay away from any form of gathering and still really regard that recommendation. We're starting to see a little bit more even out between the male and female. Females at 51% from this last week versus males 49%. However, as I mentioned last week, males have a higher incidence of being sicker and actually passing away. And so grateful that we're seeing more of our male population being tested and hopefully tested earlier. That is something that we're trying to concentrate on, making sure that people don't wait until they're very ill. Here is our total number of tests. This does not account for yesterday at the screening clinic, and so this would have been as of probably about Tuesday. So you can see about 400, just probably shy of 500 tests. And our negative, this shows a little different here. If you look over on the right-hand side, you'll see the percentages. And so we're about 15% positive. Interestingly, we have maintained that percentage, 15% positive versus 79% negative, and we have about 6% pending. As of right now, we have probably over 30 pending. As of yesterday morning, we had 29 pending, and so might have a little bit more pending right now. Sometimes when you see those numbers, and I think I mentioned this, but I just want to re-mention it because I get people who call, and it's always okay if people call. I'm always happy to share good information, but sometimes they call and they feel very discouraged, and I have to help them understand. Sometimes we are really waiting for that number of tests, but sometimes when the state calls, they just call and we don't get the actual faxed results back. And so while we might have like 12 pending and we would get 2 positives, but we don't know if those other 10 have actually cleared and they're negative or if they haven't been tested yet. And so they continue to ramp up on our pending. And so that's why those numbers sometimes seem really egregious, very large. Here is our new cases by day and our 7-day average. You'll notice since probably about the beginning of May, we've started to see a bit of a spike. I'm going to show you another graph here in a minute that will help, that Alicia put together, that is helping us see that a little bit better. As far as just overall average growth, here's our 1.28 cases per day. And then this is a newer graph that shows our percentage self-isolating versus recovered versus deceased. We do have one relocated, so let me just explain that the way the numbers work, if somebody is tested here, but they convalesce in a different part, we do not count them. If somebody's tested somebody someplace else, but they convalesce here, we do count them. And this particular person that relocated was a truck driver and went back to the home state. And so the home state picked up that person, but we still carry him on our books so we can maintain our case numbers, if that makes sense. And so that's why we count that. Let me show you just one other thing here. See if I can pick it up. Okay, if you can see this graph, I apologize, it's probably a little bit small, but Alicia Heiser put this one together to show that from day 0 to 32, we had a growth rate of 1.13 cases per day. And then starting at about, again, that just a little bit before May, from days 33 to 47, we went up to 2.33 cases per day. And certainly we all noticed that elevated curve there. And it will be interesting in the next week to see what this will look like after our testing and other things. But what I want to stress, and I'm sure Dr. Stringham wants to stress, is even if we see a spike from community testing or from these other things happening, it's a good spike. one of the questions that I keep getting from people is, why are we seeing more growth if we have the FAST team? And my point is, that's exactly what is happening. The FAST team is doing their job. We are getting people tested, we're getting people into quarantine, and that's why so many times on the results that I send out, you will see that they had contact, they had previous contact. That means our FAST team is doing exactly what they're designed to do. I'm happy to answer any questions or send it over to Dr. Stringham for any thoughts.
Any questions of Nicole on the graphs that she's presented? If you have a question on Mike, *6. Dr. Stringham? Do you have any comments, Dr. Stringham, on these?
I'm sorry. I think that one of the downsides is the time that we're doing the community testing is going to coincide with the time that we've opened businesses. And so I think that the downside is that there may be some data contamination where the number of cases starts to grow as a result of people who are being tested. And so that'll be kind of interesting to see. We'll have to be able to ferret out the difference between those two. And then the other comment will be that it's going to be interesting to find out if we have a lot of non-symptomatic cases in the community. And I would offer speculation before that. And it's interesting, I had heard that yesterday, apparently, one of the surrounding communities had tested 49 individuals. And this was another county in Nevada that tested 49 individuals, all of whom had no symptoms. So they were all asymptomatic, non-symptomatic. And 14 of those 49 cases were positive. And I'm very, very skeptical about that. And the reason is because if there were a lot of asymptomatic cases, then we would be seeing a different type of a pattern in the data, and we're not seeing that. So the cases that we're seeing that the FAST team is investigating, almost all of them have connections with people who are known to have the virus. And so if this were largely non-symptomatic, and there were many people out there who were infectious, who had no symptoms whatsoever, we would expect to be seeing more cases popping up without any obvious or apparent connection with known cases. And that's why I'm very interested to see what the data shows, the data from the non-symptomatic community-based testing. And I think we're going to learn some wonderful lessons, although I would offer the explanation that I just gave that to be evidence to the effect that I don't think there's as much asymptomatic or non-symptomatic cases as there could be.
Okay, thank you. Any questions? Okay, let's move to the next item. The testing plan following economic reopening, consideration, discussion, and possible action regarding a strategy for COVID-19 testing in Humboldt County as part of the county and city of Winnemucca's protocols to slow the spread of the virus while implementing tactics to reopen the economy, including but not limited to testing options, availability of test kits, and a reasonable plan for who and when to test to ensure the reopening is successful. Do you have some more to expound on that, Dr. Stringham?
I think we're going to have to wait and see what happens with the community, with the reopening of the so-called non-essential businesses, and really looking forward to seeing some of the data. And I think that it's still a little bit early to see what the medical aspects are going to look like from this. And so my recommendation is that we continue to do the things that we're doing now. I think our biggest area of influence for right now is to have lots of communication with various business owners to make sure that people are doing all the things that they need to do. I know that Dave Mendiola's office has received, and I've reviewed most of the applications and kind of the business plans, the safety plans that have come into his office. And I'm really impressed by the answers that people are giving. In a lot of cases, people are giving details of what they're doing and having some pretty good ideas. And so I think that at this point, the big thing from the community standpoint is that everybody needs to wear masks in public. Everybody needs to do the social distancing from the community standpoint. And then from the proprietor, the business owner standpoint, the critical thing is to make sure that the people in the stores, both employees and patrons, are doing the right things, that they're social distancing. One of the kind of the weak parts in our system is that the way that that we do things, the safety recommendations are just that. There really aren't a lot of teeth in a lot of the recommendations that are made, so there aren't specifically as many laws as other cultures potentially would implement. The guidelines in our culture, Peter and Humboldt County, pretty much are just that. And I think that's appropriate. It's the way that we do things. It's our system. And I think we can look forward to having a lot of cooperation from the various people who are stakeholders in this. So my recommendation would be, if you're a member of the public, make sure that you're doing the right things and make sure that that your behaviors and those of others are going to help to create the data, the cases that we don't transmit in our stores, to show that that we can do things safely and to continue our opening process.
I've had several questions, Dr. Stringham, come to me about agriculture events or community events. We don't have anything from the governor on that as of yet, but do you have any suggestions or comments, thoughts on?
Yes, in fact, I'd heard about those also. And as an example, I'd reached out to the school, as I said earlier, to make specific recommendations. And I think that what I'd like to do is, if there are specific agricultural events or other events in other sectors, I'd like to be able to know about each of those so that we can partner with those groups and make sure that if those events are going to happen, that we can do them safely. The school has done that. A number of other organizations have done that. And usually, if we can just oversee things and make sure that things can be done safely, in many cases, people can have their events as long as they're lawful and aren't specifically precluded if they're not addressed. And we can partner with those folks to make sure that the virus is as non-obtrusive to our lifestyles as it can be, but yet still is as safe as it can be. And I'd like to take this opportunity to explain to the public that most of us enjoy these events also. Most of us enjoy doing the types of things that we're talking about. And so I know that there's a community perception among some that that there's a lot of oversight and a lot of control. And I'd like to assure people that our intent is never to control or to limit people from doing the things that they want to do. Our intent is only to improve safety and make sure that people are able to do those things correctly if the events can be done safely.
Thank you, Dr. Stringham. Any questions? Hearing no questions, we'll move on to the next item. Review and discussion regarding
Ken?
phase one. Yes. Yes. Is there someone there that wants to speak? You need to unmute if you have something you'd like to ask. Star 6. Okay, we'll go on. I'll start this over. Review and discussion regarding phase one of opening for the economy. Review, discussion, and possible action regarding the opening of the non-essential businesses, which began on May 9th, based on Governor Sisolak's announcement on phase one of the road to recovery, to include, but not limited to, necessary restrictions which may be necessary to ensure the success of the reopening, and including, but not limited to, any legal options within NRS 441A and duties the Health Board may take to protect the health and safety of the citizens of Humboldt County. Consideration of an amended form to present to patients that are asked to self-isolate, outlining the legal ramifications of not following the guidelines for self-isolation. And I'll go right to Mr. Mendiola on this. I think you have some information for us.
Thank you, Mr. Chair. Dave Mendiola. I think I'm going to probably defer to Wendy first, and then I will come back and give a little additional information. So Wendy, if you want to take over.
Okay, this is Wendy Maddox for the record. I have been working with our office and the Attorney General's office this week in regards to NRS 441A. We are working on a form to be given to people when they are tested, regardless of if they've actually received the results for that test. And it lays out the requirements to quarantine and also the legal ramifications if they don't follow that. So we're just planning on having a meeting as well later this afternoon with the city attorney as well as our office, Dr. Stringham, to kind of figure out where we go from here. Thank you.
Mr. Chair, Dave Mendiola. As Wendy mentioned, there's a new form that does identify NRS statute that gives guidance to those who have tested positive and are going into respiratory isolation as to what their responsibilities are. And so that is beginning. You know, in the past, I believe the form was more, here's how you do it. This one will include specific information on the kind of legal ramifications of not following the guidelines. And there are some that are applicable that we would enforce. So, but with respect to that, we're going to talk more about that, as Wendy says, this afternoon with the legal folks and Dr. Stringham, to just wrap our arms around the kinds of things we can do just to be prepared. And again, our goal with this is to make sure, because we've gotten a lot of calls from people saying, why don't you stop somebody from going somewhere, and those types of questions. And we don't have that kind of authority. There are rules that they should follow, and if they don't, we can take some actions, but we certainly can't rule people's lives on a day-to-day basis. We just don't have the resources. Nobody does. With the exception of some other counties are trying some different things that are kind of interesting. But, you know, hopefully we're on a path here where we never really have to go here with this stuff. But time will tell. I think the testing will be very helpful overall to give us a better sense of where we are and what's going on in our community. So that'll be good. But that's really the effort here, is just to make sure that we are doing everything we can as the health board and our health officer to, you know, to encourage people to do the right things. That's really what it comes down to.
Thank you, Mr. Mendiola. Do we have any questions of Mr. Mendiola? Wendy? No questions? We'll go to future agenda items. You have anything down specifically, Mr. Mendiola?
I do not. So what I would recommend is I kind of like the outline that we're currently using. We cover a lot of data information. And by the way, I'm getting a lot of information back from people who really appreciate the format and get on. And we're averaging about 72, 73 people for every meeting, which is really great. And so, and they're going out, and I actually spoke yesterday to 2 separate people who said they were not on the call, but they heard from a friend and got an update from the friend. And then another couple of people told me that they weren't on the live call, but they went on the website, which is where I'm going to remind people right now. If you go on the Humboldt County website, hcnv.us, you can find all the recordings of these meetings, as well as a number of other things. There's some specific recordings from Sheriff Allen, Dr. Stringham, Chief Garrison from Winnemucca PD, some of our hospital folks up there that have done some great things on YouTube. The links are on our website. And again, there's just really good information on what's going on and how we're dealing with COVID-19. And the more information we can push out, the better. And again, Nicole, thank you very much for all the work you're doing. It's very, very helpful, especially the investigative work that you're doing on so many different fronts to find out how do we get information to people. So I thank you very much. But so I think we're going to stick with the format, but I do encourage any of the board members or any of the public, if you have an idea of something that might be useful, please give my office a call, 623-6300, or you can call or email administrator@hcnv.us. and leave me an email and give me some ideas, and be happy to add those as well.
Okay, is there any other questions on future agenda items?
Mr. Chairman, this is Commissioner French.
Go ahead, Commissioner French.
I had a couple of questions, and I neglected to bring them up, I think, at the appropriate time, but I'm echoing some inquiries that I've had having to do with cloth masks. I know that Mucka mask makers are still hot at it, and I think they're over 5,000 masks that they've made at this point. But there was an email that went out from State Emergency Management indicating that there was a supply of cloth masks that were going to be allocated to the rural communities from the state stockpile. And I'm wondering if we have any idea how many of those were going to be available, and if and when they're going to be available. I know there's some fairly large orders for the Mucka mask makers for some of the mines, and I just it might be more appropriate to utilize some of those masks coming from the state stockpile. Thank you. And I guess I would direct that to Dr. Stringham. Maybe he has heard from them at this point.
Commissioner French, if you could send me a link for any information that you know about that, what I'll do is investigate it here today and see what the situation is. I had heard a rumor about that also, and but I hear a lot of different things, and so yeah, if you could just send me some information, we'll follow up on that and see if we can get the masks to the appropriate people even before our next meeting.
Great, I appreciate that, Dr. Stringham. I'll get that to you today. Also, the second question I had from the community had to do with, are there plans for community-based testing with regard to antibodies? Are we going to try to isolate or at least document what the infection rate was within the community for those people who have been infected but didn't know it?
Yes. I'll answer that one too. I haven't heard anything specific in the early days. That was really what I was hoping to see. And the issue of antibodies versus the antigens, which the so-called nasal swab test is, they really answer completely different questions. Nasal swab really answers the question of how many people currently have this infection, and it's kind of a moment in time, whereas the antibodies are letting us know who has had the infection in the past. And of course, there's a certain period of time required to make those antibodies. So they answer two completely different questions. I'd heard initially when we had first heard about the state's community-based testing program, my understanding was that that was going to be for antibodies. And to be honest, I was somewhat surprised when the antigens were the primary things that we were testing. In the early days, the antibody testing was not very accurate. And there are a couple of proprietary companies that have kind of risen above their competition in accuracy, and the positive and negative predictive values, meaning the probability of getting a false positive or false negative, are much better on the newest iteration of the tests. And so I suspect now that the tests are better and the data on the antibodies will actually be of use, I think that the state would be well served and our community would be well served by getting that data for the antibodies, but I have not heard anything specifically at this point. I'm sure that we'll be hearing about that in the next couple of days. Presumably it would be a different community-based testing program that would be done at some point in the future. The difficult parts about that are that the antigen testing for the actual virus itself, is done through nasal swab, which is easier. It's not a very pleasant thing to do, but it's far easier. The antibody testing, on the other hand, really is done only by blood because that's where the antibodies for the virus are located. And so logistically, it's a little bit more difficult, still quite possible. And but I would absolutely love to see that data. That would be great.
Thank you, Dr. Stringham.
Any other questions? Any questions?
Yeah,
Commissioner Cherry, do you have anything else?
yeah, I have one, and I failed to ask this question earlier as well. This is for Dr. Stringham. You know, we've seen a steady, unfortunate, pretty rapid increase in cases in the last 2 or so weeks, but we don't see that same trend as far as when numbers go in recovered cases. And if it's been said how it is deemed, how a person is deemed recovered, then I've missed that. But how do you go about saying that this patient has recovered? Is it through continued testing until they come back negative? Could you expand on that and tell us?
Absolutely, Commissioner Cherry. So the reason there's a little bit of confusion about this is because we're almost shooting at a moving target, and the definition for cure or for putting making sure that a person doesn't have this virus any longer, there are a number of different ways a person can get into that category. So it can be done and has been done in the past by criteria, meaning if you have gone 7 days or greater from the time that you initially had the symptoms and you're still doing okay and things are going well, that has been considered a cure. I don't agree with that, but that's one of the lightest of the criteria, most minor of the criteria to consider a cure. I would consider a cure to be 2 weeks with absolutely 2 weeks from the time of onset of symptoms and doing well and test negative, have an actual test that is negative and ready to go back to work. And I would consider that is my definition of a cure. I know that the data sometimes gets contaminated based on the fact that there are a lot of different ways that people can enter that process. So that's one of the issues. That's the definition I would give, and some of the loosest of definitions that are used by others sometimes to put people into the cured category. The other reason that the data shows more people are acquiring this virus, and yet that proportional number are not recovering, is because we're still fairly early in this process. And because the number of cases has grown in the first probably 4 to 5 weeks, we were adding about 1 new case per week. And then over the last 2 weeks, we've added 3 cases per week and 2 cases per week on average. And so because the number of new cases is disproportionately larger as a function of the total number of people, that's the reason that the number of people who appear to be recovering does not appear to be growing as quickly as the number of new cases diagnosed is growing. One of the difficult parts in the sciences we always have what we're hoping to show, what we're hoping to look at, but then we have what we're actually measuring. And by cures, we're only measuring the total number of people who no longer have symptoms who fit into that category. We're hoping to show that a certain percentage of people do recover from this. And unfortunately, the data that we're collecting doesn't have the capacity to show that. Once we've had this virus for a number of months, and once the number of people who are getting this virus is smaller than had been the case, then the number of people recovering will appear even larger than it truly is. So.
Okay, so if a person is asymptomatic, you don't show any signs of the COVID anyway. So then you'd be considered cured when your test came back negative. Is that how it would go?
Yes, I would say that there'd be a few different things that you'd have to see. So exactly right. You'd have to show that the person no longer has symptoms, and have to show, by my criteria, that a person has at least 1 negative test. In some cases, we're using 2, and also have to show that there are no residual issues with that person, no reason to suspect that the virus is still active in that person's body.
Thank you.
Dr. Stringham, on these individuals that would show recovered, is that your call that goes in, or does that have to come from the state?
That's an excellent question. There are a few different criteria that are used. And my understanding is that technically it's my call, and that the state has given each of the various county health officers throughout the state the capacity to define things the way that we want to, the way that we see as being best. In most cases, our interests and the state's interests coincide. And when they don't, we typically dialogue with them and find out, why they feel the way they do. And I think they're very receptive to our ideas. But yes, there sometimes can be some discordance between the two entities. For example, the state up until relatively recently had been sending out a letter that I mentioned previously that indicated that a person could be considered ready to go back to work when they had 7 days that elapsed from the onset of symptoms. We did not think that was reasonable. And so we wanted to go with a criteria that was a little bit more rigorous, more likely to yield answers as to whether a person truly was infectious. Some of the counties required 2 tests to be done, 2 consecutive negative tests that indicate that person is then cured. And so the difficult part is that my suspicion is that various criteria are getting into our system, and that looking at the number of people who are showing cured, not all of those patients would necessarily truly be cured by all criteria.
Thank you. Commissioner Bell, do you have any questions?
Can you hear me now?
Yes, I can.
Oh, okay. No, at this time I don't have any further questions. I think everybody's answered everything for me. I just thank everybody for all the work that they're doing. That's all I have. Thanks.
Thank you. Commissioner Brizendine?
No, I don't have any questions. I have been trying to encourage everybody to go get tested, from the elderly to the younger. A lot of folks are telling me that they have not shown any symptoms, so why should they get tested? And I told them it's going to be part of a database, and it'll also help encourage us to be able to get into phase 2 of our business openings. And then I've had a lot of people that have said, okay, so if I go and get tested, I'm going to, and I show positive, my family's, what are they going to have to do? And I said, well, if they've been around you, they're going to need to self-isolate. And it's like a lot of folks are worried about not being able to go to work, is what the feeling I'm getting. And I've been encouraging them, we've got to get this somehow under control and get a real live number of what is going on in our community. So, but thank you. Yes, I thank everybody too, because I've been hearing about the peer-to-peer pressure and folks saying, I'm not going to get a test, are you? And that's really sad. And I'm happy that this message has gotten out today with what Nicole Maher has said and Dr. Stringham. So thank you.
Thank you, Commissioner Brizendine. Sheriff Allen, do you have anything more to add or any questions?
Yes, I do have something to add. So this is for everybody, but specifically Commissioner Cherry. The testing is scheduled right now for next Thursday up in Orovada. That's the proposed date. I don't have the time just yet, but we'll get that out as soon as we know. And once again, this is subject to change, just as this event, this pandemic is very fluid, and we might have to readjust priorities or something as the event dictates. But right now it is planned for next Thursday in Orovada. Thanks.
Thank you, Sheriff Allen.
Thank you.
Mr. Chair,
Yes,
Dave
Mr.
Mendiola,
Mendiola.
I'm just wondering if Tiffany Love is on the line still. She was earlier from Humboldt General Hospital. And if she's got anything she might want to add, let me see if I still see her here.
Yes, are you still on there?
I don't see her. Sorry, I should have looked first.
Mr. Chair, I was on the HGH conference call yesterday, and I know the one thing they wanted to get out to everybody is that the testing would not be sent over to the hospital. It goes directly to the state from this community-based testing. And I know they wanted to get that message out, that test will not be done at the hospital or even sent over there. They go directly to the state. So I'm not sure if that's what she wanted to say, but that is one thing that I had heard.
Okay. Dr. Stringham, do you have anything else to add?
No, I sure don't. I was very honored to have been selected for the Nevada State Award. I'd like to thank the people who put that recognition contest on. I'd like to let everybody know that this is really only an accomplishment that I've been a part of. It is not an accomplishment of mine. It's an accomplishment of the community, and I'm really pleased to be able to work with all the people that I work with. The virus has not been very much fun to combat, but I'm having a wonderful time working with all of you and helping to represent the community. And as I told Ken this morning, I think they certainly could have chosen a better looking person to be the poster child for COVID-19 response in Winnemucca, but I guess that's their bad judgment. So thank you very much.
Well, congratulations on it anyway. Thank you. With that, we're going to go to public comment. Do we have any comment from the public?
Ken
Could you
Tipton, it's
please,
Paige Brooks.
Okay, go ahead, Paige.
I just wanted to say, I wanted to let you all know that most of the shops are open, and we did have a visit from State Board yesterday of Cosmetology, and I believe we did quite well. Rumor has it that we were about the only beauty shops that took temperatures and so forth. So I just wanted to update you on that end.
Wait, when you said the only beauty shops, is that in the
Well,
state?
it's not a required thing. Yeah, well, so it's Nevada where this State Board does. So we mainly from Reno up to the north, but I'm sure he's on his way to Elko and so forth, and they may be doing it, but he had not had that done until he came to Winnemucca, Nevada, and it's not a requirement, but we have advised our people to up the ante. So.
Okay, thank you.
You betcha.
Appreciate that.
Mr. Chair, Dave Mendiola, while we're waiting for somebody else to key in here, along those lines, I was going to mention that I've gotten a lot of calls from local businesses, both, those who have sent in their original form that we asked them to fill out, but others wanting, me to come by and make sure that their facility, they're doing all the right things, and if I could see anything else. And so I have walked through that with several owners, and I tell you what, they're just going above and beyond. They're very much concerned about doing this the right way. So I feel really good about where we're at with there. I can only assume that because of the number of forms that have come in and the calls that we've had, is that it's really being taken seriously by the vast majority. There may not even be any outliers, so I feel very good about that.
Thank you. Do you have somebody dialing in or coming in on the meeting, Dave? Do you have any public comment? If you do,
Good morning.
identify. Go ahead.
This is Ashley at the Humboldt Sun. I just have two really quick questions. One, I missed the first 24 minutes, and so I was wondering where I can access the recording afterward. And then the other question regarding testing, it's my understanding that when somebody gets a test when they're presenting with symptoms at the hospital, that they're asked to self-isolate until they receive a negative or positive test result. With the community flu pod or the community testing pod for COVID, I just want to confirm that the people that are being tested that are asymptomatic are or are not being asked to self-isolate after they take their test.
I can take that. So the answer is it really depends on whether or not a person is likely to have the virus. Since the community-based testing folks are not likely to have the virus, those people are not required to go into isolation. But since the people who were testing for either symptoms or contacts with folks at the hospital, so the symptom-based or case-based testing, we do require that those people go into isolation. So once again, I'd like to emphasize that if members of the community go to the community-based testing program, they do not have symptoms, they do not have known exposures recently, they're unlikely to have the virus, and so those people absolutely do not have to go into respiratory isolation.
Perfect.
Is there anyone else who'd like to get on public comment? If you do, *6, unmute and identify yourself, please.
Mr. Chair, Dave Mendiola, I wanted to answer Ashley Madden's question. So the recording will be available on the Humboldt County official website. It takes us, because they're pretty long, it takes several hours for them to completely upload. So I would suspect that after 4 or 5 o'clock this afternoon, they'll be available on the Humboldt County website. And if you go in there at the very top, it says COVID-19, click on that, and there's a listing of all kinds of recordings, agendas we've had, and any other information directed at COVID-19.
Perfect. Thank you.
There's someone else for public comment. I want to make sure that we offer anyone out there that wants to comment publicly to do it now. Is anybody else trying to get on, Mr. Mendiola?
I do not.
Okay, with that, we will go to adjournment at 10:36 a.m. Thank you very much, everyone.
Thanks, guys.
Thank you.
Thank you.